It was the biggest trial in Germany ever.
He's suspected of murdering more than 100 patients.
After the Second World War, the most serious murderer in the history of Germany.
It's hard to imagine how he could have got away with killing so many people.
Delmenhorst is a small town between the urban centers Bremen and Oldenburg, about 70,000 inhabitants. My name is Arne Schmidt. I am a member of the Lower Saxony Police and I'm the Vice President of the Oldenburg Police Authorities. During that time, Delmenhorst had two hospitals, the former municipal hospital and a Catholic hospital. All the nurses went into the patient's room.
Dieter was a very, very vulnerable patient whose circulation had effectively almost collapsed. My name's Dr. Sarah Jarvis, and I'm a GP. Niels Hogel was standing at the end of the bed. He looked up when the nurse came in and said, "Your patient has no pressure."
She discovers all the equipment sustaining the patient is switched off. I'm Donna Youngs. I'm a professor of investigative psychology. Dieter's slipping away. Dieter's blood pressure is plummeting.
Immediately they sprang into action and began resuscitations. And indeed, the patient did respond to that.
All the time, Niels Hogel just stands in the room in a state of shock. He has no reason to be there anyway.
After that, the male nurse looked into the garbage bin and found 4 empty ampoules of the substance Eichmelin.
By this point, the nurse is suspicious.
Gluritmal, the real name for it is Eichmelin. It's used very rarely because it's usually used to treat abnormal heart rhythms in a condition called Brugada syndrome. Now, it can be life-saving in those situations, but if it's given in the wrong hands or to the wrong patients, then it can cause catastrophic slowing of heart rate.
The nurse takes a sample from her patient, and her checks of the medication storage reveal that one package of gluritmal is missing. Lo and behold, they discover in the blood gluritmal.
And there should have been none at all.
The nurses informed the senior nurse, and the senior nurse informed the chief doctor of the intensive care unit.
Someone saw that he has put the injections in the litter, and they recovered it, and they said what it was. That it was gluritmal, and no one prescribed gluritmal to the patients, and they asked him what he's doing there, and he has no good answer for them.
The management of the Delmenhorst Hospital reacted in a very slow way. Niels Hogel was able to work on the 23rd and 24th of June.
It was suspicious for some colleagues. My name is Marco Seng. I'm a reporter for Nordwestzeitung Oldenburg. It's a newspaper in the northwest of Germany. A colleague searched his locker and they found a lot of medicine who shouldn't be in this locker and who shouldn't be in a nurse's hand.
On the 1st of July, the Delmenhorst Hospital informed the Delmenhorst police that they have to report about a nurse. So the investigation started at the 1st of July 2005. The management of the Delmenhorst Hospital separated themselves from Niels Hogel. They quit the contract with him. Niels spoke with the detectives. He was interrogated and he said that he gave the substance Eismelin to the patient DTM because his heart was too fast. And the substance Eismelin makes the heartbeat going slower. And Hogel said, yes, I gave this substance to the patient, but I did this because I wanted to help the patient. He admitted that he gave the substances to this patient. But he said that this was the first and the only time he acted in that way. Niels Hogel was born in 1976 in Wilhelmshaven.
Wilhelmshaven is a city at the North Sea coast in Germany.
His father was a nurse, his mother was a homemaker. His father did a little bit of work in local politics, and apparently it was all pretty idyllic until they separated. His parents separated when he was about 11 years old.
He was good in school, he played soccer well, he had a lot of interests. He wanted to be a fire brigade man, and there was nothing special about him.
It was probably, at least in part, as a result of his father's profession as a nurse, that he decided to become a nurse himself. Niels Hogel had a great time when he was studying nursing, although increasingly women, drugs and alcohol played a larger and larger part of his life. But apparently he enjoyed things very much. He managed to scrape through his exams and he did get a job.
The Oldenburg Clinic was one of the most popular clinics, especially for heart surgery operations at that time.
He was liked. He had a lot of jokes, made a lot of jokes. Most people liked him. He was a little bit arrogant for some people, but most people liked him. The colleague said, Niels, please come and help us if there was an emergency. And Niels helped, and Niels was good at these things.
But there are aspects of the way that he's behaving in the hospital which are making people start to become a bit suspicious. He seems to be desperate to be at the forefront of emergency situations.
And there are certain people perhaps who are attracted to the heroic side, as they see it, of performing heart surgery and saving people's lives, bringing them back from the brink. But by the same token, the idea that one person was constantly pushing themselves forward to be the hero, there seemed to be something really odd about it.
He gets names like Rettungsrambo.
It all speaks to me of somebody who feels the need to prove himself. It feels like the need to feel that he can do it, that he can match perhaps his father, that he is up to this job.
This good certificate Niels got at the Oldenburg Hospital was an important reason for getting the new job in the Delmenhorst Hospital. So this certification was a kind of door opener. His getting in was great there because the colleagues saw in the person of Niels the experienced nurse from the special investigation unit in the bigger town of Oldenburg.
People are starting to have what they refer to as strange feelings about Niels. There's a real sense of uncomfortableness, but nobody does anything. And I think this is because Niels is very socially integrated. He comes from a background where he doesn't seem like the kind of person that would do anything untoward.
If you have hints in the hospital, you have to talk about it. You have to call the police if someone is suspicious. They don't do these things at all.
In the case of Dieter, Hogel was caught red-handed. The infusion system had been switched off.
Hogel was sentenced not for murder, but for attempted manslaughter to a 5 years imprisonment and a 5 years ban from work. But Hogel himself appealed against this judge and the widow of Dieter M. appealed too. And the federal court had to look at this case one more time.
It's an interesting part of the story. He was sentenced to 5 years in jail, but then was a revision and another trial about the same case. And in this time, between these both trials, Hogel was free.
It was a very small regional media interest during this time.
It was only one case, and they didn't tell us much.
They took a picture of the nurse of Niels in this newspaper report, and this was read by Katrin, a woman who lived near to the town of Delmenhorst and who lost her mother, Bridget, at the Delmenhorst Hospital in March 2003, about 5 years ago.
Catherine Lohman, who's had a constant sense of unease about the death of her mother, and reading about Niels Hogel raises her suspicions.
Brigitte had been severely unwell and had been in intensive care, but she was getting better, and indeed she was looking forward to going home. When her daughter rang to inquire about her, a male voice answered the phone and said she's fine at the moment, which her daughter thought was a very strange thing to say.
For her, it was a suspicious voice, it was a suspicious man, but in this moment, she took it as it is.
During the night, there was a call to say that Brigitte had deteriorated suddenly, and indeed, she died. There was no reason to believe that she wasn't going to continue getting better.
The police detectives in the Delmenhorst police department were unsatisfied with the patient Dieter investigation.
The police wanted to look for what happened really, if it was only one case or there were more cases.
She realized that this nurse had something to do with the surprisingly death of her mother too.
She discovers that indeed Niels Hogel was on duty the night her mother died.
She called the police in Delmenhorst and reported this to the colleagues there. The detectives found out that the mother of Katrin died just at the time where Niels Hogel were in service.
When a patient dies unexpectedly in hospital, then there will always be a post-mortem. But of course, you can't do toxicology looking for every single drug. When it's a very unusual, rarely used drug like adrenaline, you are only going to be looking for it if you have a suspicion that it may have been used. And that was why no cause was identified at the time of the death.
It was very important to exhume the body of Bridget and to find the substance Eichmelin in the exhumed body. At that time, this went to the conclusion that the very special substance Eichmelin, just very fast out of the body of a person, that they are not able to find this after a long period between death and medical examinations. Maybe there's no possibility to get the necessary evidence that Bridget was a victim of Niels Hogel.
It was only when Brigitte was exhumed and the doctors specifically looked for adrenaline that they found it. And almost certainly that meant that Catherine's mother too had been a victim of Niels Hogel.
They were ill and defenseless. That's the main fact.
It's not entirely clear whether Hogel intended to kill or whether he wanted to be a hero and to be doing the resuscitation, or whether it was a mixture of both.
He told the police and he told a lot of lies. And he said only that what they know, not more.
What I think you're dealing with when you look at Niels Hogel, he lacks any emotional maturity and also lacks any real human emotions because he's switched off. Here is somebody who was brought up in an environment that was so safe, so secure. We know his father was a very controlled, very reserved man. Everything was utterly perfect and stable. And I think that to Niels Hogel, to anyone, this might have been experienced as slightly oppressive. I think Niels Hogel found that he wasn't up to his father. There was no room for him to develop his own way forward, his own story.
The detectives who was in charge at that time wanted to find out what's really going on at the Delmenhorst Hospital, and they tried to do it, and they persuaded the public prosecutor to get on with some more exhumations. They exhumed 8 further bodies. From these 8 patients, 4 was poisoned with Eichmelin. A new public prosecutor came onto the scene and found the cases in the office, was wondering about this because old cases about murdering, this is not normal. And she started up all the things again, and they accused the 5 counts of murder at the regional court.
A colleague came in and said there was a trial and there was a nurse murder who was accused for 5 murders. And he asked me and my colleague, we are the reporters, could you go to the trial? It was a small trial. I think it could have been different if it had happened in Berlin or Hamburg or Munich or London maybe. But the people don't look to Oldenburg and Delmenhorst. It's far away.
Niels had to get to the court out of the cell in the prison.
At first, he's a big liar. He told a lot of lies. Some doctors came to the trial and said there are much more murders, maybe 100.
Niels Hogel confesses to the murder of 30 patients and the attempted murder of up to 60 more.
Niels got into the patient's room, injected the substances into the body of the patients, and then he deactivated the medical surveillance system for 30 seconds, leave the room, and then after the 30 seconds period was over, the alarm went on because the cardiac system of the patients failed down. When the alarm gets on, Niels ran to the patient's room again and start the resuscitation of the patients, which mean injecting resuscitation medicine like atropine or anything like that, and start the manual cardiac pressure massage, and later on the electric shock massage to the patient. At his early times, he went to the hospital to provoke resuscitations and to be a hero after a successful resuscitation. But this could not be his motivation over all the period. The prosecutor came to the decision that at the end of this time, Hogel wanted to kill patients.
Looking back, it's hard to imagine how Niels Hogel could have got away with killing so many people and how it could have taken so long to discover what he was doing.
When we started our investigation, we become very early clear that this is a very complex and a very complicated case. The trials only were cases from the Delmenhorst Hospital.
At the beginning, Niels Hogel said, no, I only heard people in Delmenhorst.
The more and more evidences we were able to present him, the more and more he switched over to don't know. He denied his responsibilities. At the second part of our interrogation, he proved that he murdered even at the Oldenburg Hospital too.
We don't know exactly when it was the beginning of this all, because nothing it's like it seems in this case. 10 years ago, we only know Delmenhorst. We don't know anything about Oldenburg. You have to imagine that. So, and now we know that he murdered in Oldenburg first.
The first murder we have on February 2000. And at this time, people died more and more often. But mostly the patients were in coma. It is an intensive care unit. It was not very difficult for him to inject the poison.
Niels is also present at almost all of the resuscitation incidents that seem to be occurring.
The idea that one person was constantly pushing themselves forward to be the hero, and that simply the normal number of people collapsing and dying or needing resuscitating was not enough for him, began to grow as a suspicion in the minds of his colleagues.
Niels Hogel gets wind of this and calls in sick and is off sick for a 3-week period. During that period, there are just 2 deaths at the hospital.
When Hogel came back to work, in the 3 days after he came back, 5 patients needed resuscitating, no fewer than 14 times in just 3 days.
This was a weekend, we call it in our investigation team the Black Weekend. Niels had more than 3 times more deaths during his service time than all the other colleagues at the intensive care unit in Oldenburg. It became more and more clear for us that we need hard evidence. We had to know who are the patients who died during the services of Niels Hogel. We had to find out where and in which way the victims were buried.
They go to the cemeteries in the region, and then they reconstruct what he probably did to these bodies.
We only could get our evidences from the victims. They were buried into the ground.
Giluritmal or adrenaline was undoubtedly Niels' drug of choice. It was, as we've already heard, a drug which is used for abnormal heart rhythms. But he used other drugs for abnormal heart rhythms, including lidocaine, more often used as an anesthetic, but also used for abnormal heart rhythms, potassium, which in high doses can cause deadly abnormal heart rhythms, and sotalol, which is a beta blocker, which, again, in the wrong hands, can result in life-threatening slowing down of the heart.
He got his hands on all these medicines. It was easy at this time. There was no safety at all. He could order the medicine and use it.
The investigation go over a period of more than 3 years, and there were many challenges. The number of possible victims was a big challenge. The long period between the deeds and our investigation time was a big challenge. The planning of the exhumations through 64 cemeteries, dealing with the many relatives of the victims. They had to be informed about the possibility that their beloved ones are not died because they were ill, but that they maybe died because there was a murder on the intensive care unit. That was a really big challenge too.
The police can identify evidence suggesting Niels Hogel has murdered more than 100 patients. And indeed, suspicions of up to 200 patients exist. Even to somebody who studies murder, this is a staggering number.
Every case where we were able to present him hard evidences, like toxicological evidences, anything like that, he was able to admit that he was responsible for.
10,000 pages. I've read these pages all. They have 10,000 of pages for the trial. It was the biggest trial in Germany ever.
There were much more. The other patients were buried in fire, so we were not able to prove that Niels poisoned them too.
The police expects that it could maybe more than 200. The media was very interested. It had an impact like a bomb. The biggest trial in Germany since the Second World War. The biggest trial with 400 people in a big hall.
He's facing 100 murder charges.
The accusation was read by the public prosecutor for, I think, 3 hours. At the intensive care unit in Oldenburg. In the first month, we are really sure that his colleagues not realized that something was going wrong there, because it was a very special cardiac surgery unit where the death was something like normal.
Some of the doctors, they had a list of his shifts and of the murders and bring this together, and it was obviously Hogel.
And indeed, when he went off sick for 3 weeks, during that entire 3-week period, there were only 2 resuscitations needed, way below what had been seen when he was on duty.
After the Black Weekend in September 2001, the senior doctor, the head of the cardiac surgery, wanted to separate his unit from the nurse, Niels Hogel.
The doctor said he can't work on the heart surgery. It's not possible. I don't trust him.
Niels was transferred to the anesthesia ward in a very surprising way for all the other colleagues.
The head nurse wants to get rid of Niels Hogel. They have a meeting and he's offered another position away from patients on the same salary, or he can leave the hospital. So we've got somebody that they're suspicious about, that numerous staff have commented on having strange feelings about. We've got the statistical pattern, which seems to be pretty robust evidence that what's been going on at the hospital is somehow related pretty directly to Niels Hogel. And yet we have him leaving with these glowing references talking about him as doing his job in a proficient and competent and conscientious manner.
This was wrong. This was they couldn't do something like this.
It seems likely that within a week of starting work at this new municipal clinic, Hogel had committed his first murder. What's more, Gilurumtal, which was the drug that he'd been proven to use in Dieter's case, had exploded in terms of use. The hospital had used 7 times more than it was when he wasn't working there.
This was a very clear evidence that there is a misuse of substances which leads to a resuscitation situation, which leads to the death of a patient. The Delmenhorst hospital management didn't react in any way.
No one informed the police about it. No one informed the press about it. It was going on and on and on, and he murdered more people in Delmenhorst than before in Oldenburg.
They were young or they were old, they were men or they were women. His plan was to kill them.
He didn't even remember their names.
Some said it will be bad for the reputation of the clinic. Some said we have to know what happened. We only know this case. We have to know if there was more. They don't call the police. They don't give it to the press. They call a lawyer. They discuss what to do. They leave Hogel at work.
He was able to kill another patient on the 24th of June 2005.
On the penultimate day of the trial, we have Niels Hogel apologizing. He says he's sincerely sorry to each and every one of you. This apology is remarkable. We're dealing with somebody who has no concept of what they've done fully, as if he's a child having been caught with his hand in the biscuit tin. It reveals his stunted emotional development.
He said sorry to the relatives, but I think me personally and the relatives I spoke with after the trial, they all said this was not the truth. At the end, in 85 cases, Hogel was sentenced to lifetime imprisonment. 15 cases he were not, because the judge was not able to be persuaded for 100% that Niels Hogel was responsible.
Even the judge, who spent his life dealing with criminals, said that he just could not understand the magnitude of what Hogel had done. To illustrate this, he talked about the system in the United States, where sentences for crimes are added on consecutively. 85 murders at even 15 years sentence for each one would have meant a sentence of 1,275 years.
People in this region was shocked that things like this could happen at hospitals. The fact that the management of the Oldenburg Hospital gave Niels a good certificate, even if they know what he have done there. But the good certificate was not enough for the regional court in the trial against the Oldenburg management to get them sentenced.
You can learn a lot of things. My point of view is that nothing is like it seems. You have to look twice, and you have to look with 4 or 6 eyes, not only with 2. If you have hints in the hospital, you have to talk about it. You have to call the police if someone is suspicious.
These were not murders that were driven by a particular hatred of anything. They're murders that are produced by somebody needing to feel powerful. So if you put that together with the fact that he's also socially skilled enough to be able to be operating effectively in this environment and have the access, then that's how you produce the numbers on this scale.
I hope that he will stay in prison for his whole time. I have to close this file okay, things go on.
There can be very few mass murderers who've worked in the healthcare profession who have killed as many people as he has. And it's possible that indeed this was only the tip of the iceberg. He may have killed more.